release on Saturday, January 9, we have had additional 3 more cases. The results of these cases were received this morning. All 3 cases are imported ones. They were detected through day 5 testing. They have been in quarantine since they have arrived, and they are asymptomatic. So in summary, with these 3 new cases, the number of active cases went up from 4 to 7 now. Total number of recovered cases are 102. Total number of deaths are 0. To date, total number of PCR tests completed, 8,114. With this, I want to mention that the positivity rate of this PCR testing in Dominica is 1.3%, which is one of the lowest in the Caribbean. Just to say that the lower the positivity rate is, the better it is. It has been almost 3 months that we have not seen a local case of COVID. The last local case was detected in mid-November of 2020. Since then, all positive cases were among the incoming travelers. Now, I take this opportunity to remind us again that there is no alternative to the prevention measures if we want to keep our country open and not under lockdown. Hence, we must continue to strive and adapt these prevention measures. Wearing a face mask while in public. Based on scientific publication, there is a 97% chance of you being safe with a face mask on. Maintaining 6-foot distance. The same study revealed that anything less than 3 feet, there is a 13% chance that you may contract the virus. Maintaining proper respiratory etiquette. That is to say, during sneeze, cover your mouth with a tissue or sneeze in your elbow. Avoid handshaking and touching any surfaces outside of your home. Avoid public gatherings as much as possible. The recent surge of COVID in other Caribbean countries are as a result of mass gathering. Frequent hand washing or the use of an alcohol-based hand sanitizer is also important. So with this, I thank you for your attention and have a good evening.
And our thanks to the national epidemiologist, Dr. Shaludin Ahmed. Again, 7 active cases here in Dominica. I'd like to remind the general public that these numbers can fluctuate as recoveries are recorded or new cases are recorded. So please keep and pay attention to the latest updated information as soon as they're provided. Our next presenter this evening is the Assistant Superintendent of Police in charge of the Northern District, Anthony Lawrence.
Acting Minister of Health, Wellness, and New Health Investment, Honorable Dr. Alice King. Parliamentary Secretary in the Ministry of Health, Wellness, and New Health Investment, Honorable Kent Edwards. Permanent Secretary in the Ministry of Health, Wellness, and New Health Investment, Letitia Lestrade-Wyke. Officer in charge in the Office of Chief Medical Officer, Dr. Laura Esprit. National Epidemiologist, Acting Dr. Shaludin Ahmed. Good evening, Dominica, and good evening, media and listening public. It is indeed another privilege for me to address you on our continued efforts in preventing the spread of COVID-19. The Commonwealth of Dominica Police Force is involved in a number of activities geared at minimizing the spread of COVID-19. During the Christmas season, the Commonwealth of Dominica Police Force was engaged in a number of activities geared at preventing the spread and or minimizing the spread of COVID-19. These activities include, but not limited to, island-wide patrol, patrol in the city of Roseau, and the town of Portsmouth. I can say indeed that the patrols were very successful as it led to an incident-free Christmas. During the patrol, it appeared that many people were seen adhering to the COVID-19 protocol, more particularly the wearing of masks. Wearing of masks in Dominica is mandatory, and it is a criminal offense to be found not wearing a mask in a public space. There are protocols in place for the hosting of events. The majority of our people are following these procedures. However, there seems to be quite a few who blatantly disregard the protocols regarding the hosting of events. During the Christmas holidays, the police had to shut down a number of events prematurely as the organizers failed to adhere to the protocols. The hosts were seriously warned against such a repetition. However, to date, we have had over 50 successful events island-wide. Let me remind you that permission must first be obtained from the Chief of Police prior to the advertising or hosting of any event where 50 or more people are expected to be in attendance. The Ministry of Health has done well to maintain very low numbers of COVID-19. One such measure is the mandatory quarantine requirement. Most of our recorded cases are imported cases, and had it not been for the measures taken by the Ministry of Health, Dominica would be in a similar position to many high-risk countries. Therefore, it is imperative that anyone entering the country adhere to the quarantine requirement and to follow the protocols while in quarantine. It is unlawful for anyone to breach the quarantine protocols. The Commonwealth of Dominica Police Force pledged its continued support to enforcing the laws of Dominica. Therefore, I urge all of us to adhere to the COVID-19 protocols and the measures put in place to prevent the spread of COVID-19. Together, we must work to achieve. Thank you.
And our thanks to the Assistant Superintendent of Police in charge of the Northern District, Anthony Lawrence. Next up this evening, we welcome the officer in charge in the Office of the Chief Medical Officer, Dr. Laura Esprit.
To the Acting Minister of Health, Honorable Dr. King, Parliamentary Secretary in the Ministry of Health, and that's the Honorable Kent Edwards, Permanent Secretary in the Ministry of Health, Mrs. Lestrade Wyke, to the National Epidemiologist, Dr. Ahmed, the Assistant Superintendent of Police in the Northern District, Mr. Anthony Lawrence, to our moderator, the media, the listening and viewing public, good evening. In summary, these are some critical figures regarding the COVID-19 pandemic in the Commonwealth of Dominica, some of which you would have learned before. Total active cases, 7. Total number of confirmed cases, 109. Total cases recovered, 102. Number of COVID-related deaths, 0. Number of contacts under investigation, 0. Number in COVID-operated quarantine facility, 33. Number of persons tested to date, 8,114. Number of arriving passengers from July 15th, 2020 to January 10, 2021, 5,338. Number of passengers processed normally, 3,645. And the number of passengers sent to quarantine for the aforementioned period, 1,693. I am sure that the public would agree that much has been done by the Ministries of Health and Tourism, amongst others, in defining and implementing protocols that have proven to be successful, not only at identifying persons who are COVID positive, but also safeguarding the lives and well-being of our citizens and visitors alike here in Dominica. It has been almost 1 year since we have been confronted by this deadly pandemic. Likely, we are exhausted of being told what to do and how to do it, tired of not hugging and showing signs of affection, being physically distant, and tired of wearing these masks all day long. What may be even more challenging is not having an end date in sight. And as such, we may adopt the tendency to drop our guard, forget, and continue our lives as we would normally do before COVID struck. Unfortunately, the reality is that the case numbers globally have shown an increase in recent times compared to the earlier phase of the pandemic. This means that we are not out of the woods, and hence, even more reason to remain vigilant and alert. Proverbs 28 and verse 14 puts it best. Happy is the man who is always on guard, but whoever hardens his heart will fall into calamity. Meaning, if we are always on guard like a watchman, this could help us avoid potential calamities. For the majority on the island who have not contracted this disease, it may be easy to think that we can't get it. I have heard some proud views such as, we are immune, I never get sick, Dominica is blessed. But sadly, even our Creator forewarns about being overconfident. In line with the principle of being on guard, this would imply that we must remain vigilant and cautious. It's devastating to know that so many people worldwide have died from this COVID-19 virus, and that the heartbreaking effect of this disease is not over. It's far from over. Sadly, even some of our sister islands have reported peaks in recent weeks, hence all the more reason to remain on guard. I had the privilege of listening to an interview of a young lady who lived in a rural community in one of the European countries, where she spoke of the tragic impact of COVID-19 on her relatives. She initially reckoned that she was safe living in an isolated village. Sadly, to date, she has lost 35 members of her relatives, in addition to those who are hospitalized, all due to COVID. She lamented having seen the seriousness of the disease now, likely compared to what she initially thought, as COVID was literally now at her home. She said anyone can be positive and urged all to practice good hygiene, wash their hands, wear their masks, and wipe surfaces regularly, especially after having things brought into the house. She exclaimed how serious the disease was, and she referred to it as a pandemic that takes your loved ones, as COVID-19 took so many beautiful people from her. She ended by saying, now their tools are left behind, no one to care for their fields. They prepared the fields, but they didn't have time to sow their seeds. And now their homes and transport are just sitting there. Referencing reliable information presented on a recent program on this public health matter, it was recommended that we adopt 3 principles to serve as a guide as the infectious rates continue to rise. And I quote, number 1, place a high value on life. Although the precautions you are taking may be inconvenient to you, remember they protect you and your family's lives. Number 2, listen to the authorities. When we follow their safety guidelines, we demonstrate that we really care about ourselves and our neighbors. And number 3, do not develop a casual attitude. As the situation stretches on, the tendency to be casual is tempting, but please do not lower your guard. The source proposed a question that we ought to ask ourselves. Do my decisions show that I place a high value on life, listen to the authorities, and have not developed a casual attitude? Whatever decision you make, remember that your decisions affect you, your families, and your communities. Isn't this a sobering thought? End of quote. So friends, it really takes effort to maintain vigilance and to remain on guard. But think of the personal benefits to you, your families, your communities, or country. Can you imagine losing minimum of 35 relatives in a matter of months? Ignorance should not prevail to entertain thoughts that the virus cannot affect us. Unfortunately, the reality is that in many cases, even despite best efforts of safety, some are being diagnosed with the disease. Hence, all the more reason to remain on guard and to be watchful. Permit me to reiterate that any sacrifice made to protect yourselves and your families from contracting COVID-19 is a sacrifice that saves lives. So now is not the time to drop our shoulders in regards to our safety. How we long for the day when COVID-19 will be a thought of the past. But in order to put it behind us, we have to address it collectively, in the present, being compliant, and remaining on guard. Once again, we applaud you, the public, for your efforts during 2020, and we urge you to be even more compliant to the protocols and public health measures during the coming months. In conclusion, and as always, the Ministry of Health provides you with the assurance that your safety and well-being remain our top priorities. Thank you.
And would like to thank Dr. Laura Esprit in her capacity as the officer in charge in the Office of the Chief Medical Officer for reminding us how important it is to not let our guards down, even when we may think that our numbers are low. But we have to keep in mind that around us, the numbers continue to rise. So it is important for us to remain vigilant. Thank you again, Dr. Esprit. We have the pleasure of having with us this evening the Parliamentary Secretary in the Ministry of Health, Wellness and New Health Investment, Honorable Kent Edwards.
Acting Minister of Health, Wellness and New Investment, Honorable Addis King. Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Letitia Lestrade-Wyke. Officer in charge in the Chief Medical Officer Office, Laura Esprit. National Epidemiologist, Dr. Sharaldin Ahmed. Assistant Superintendent of Police in charge of the Northern District, Anthony Lawrence. Ladies and gentlemen, good evening. The Ministry of Health, Wellness and New Health Investments recognizes the need to reach every demographic resident in this Dominica, and so found it necessary to present this information in Creole and English. So I'll be presenting in Creole and English. It is our hope that in doing so, we can further strengthen our national response to COVID-19. It is evident that the travel protocols and guidelines that we have put in place are effective in limiting the spread of COVID-19 on island. We do not take for granted that for every travel has become increasingly strenuous because of the protocols. However, we call on the cooperation of the general public to adhere to these protocols in order to keep others safe. One travel practice that has weighed heavily on our system at this time is the illegal entry into Dominica via what we refer to as backdoor. Ladies and gentlemen, it is not only illegal, but it puts our country at significant risk. Those who enter the country illegally expose others to the virus, and we are asking everyone with any information regarding illegal entry to reach out to the authorities. You may do so anonymously if you choose, but this all forms part of the responsibility to keep our country safe. Also, part of our responsibility is to continue to follow the best practices as have been established by the ministry. Remember that it is mandatory to wear your mask whenever you are in public. This includes the traveling on the bus or in a business place. For those with business establishments, restaurants, bars, or even those who sell at the market, you are asked to wear your mask and to ensure that your patrons do the same. This is the law, and those who are caught not complying will be fined. Additionally, remember to wash your hands frequently with soap and water, or use a hand sanitizer with a minimum alcohol 70%, and also we recommend physical distancing for 3 to 6 feet apart from each other. These practices have a proven track record of success in reducing the spread of the virus. For those of us keeping abreast with what is happening in other countries, we have to ensure that everyone traveling to our shores does not put the country at risk. We would hate to see a spike in the number of positive cases because we have become complacent or let our guards down. We are comforted by the fact that a COVID-19 vaccine has been developed. The Ministry of Health, and by extension, the government is working towards making this vaccine available to the general public as soon as that is possible. I wish to take the opportunity to commend the efforts of all those who have contributed to our success in this battle thus far. Every healthcare worker, frontline personnel, including fire and ambulance services, DASPA, and the stakeholders who have provided their support. But ladies and gentlemen, let me remind you that no matter what steps are put in place by the ministry or the government, no matter what protocols, policies are developed, beating this virus will take a conscious effort of each of us. You are the most important cog in the wheel. No matter who you are, you have an important role to play. Do not underestimate your value in this fight. Continue to work alongside us, everyone, and for every other well-being. Thank you. And let me just translate a little in Creole, because we know we have some people who can't understand the English, and we have some of our Haitian friends. So ça nous camande pour ça osoya c'est nous ka dizo et pas pas ouais il pas ni personne qui mort en pays, il pas ni personne qui en l'hôpital en pays pour nous d'accord tout bagay bon. Nous ni pour continuer à faire ça nous ka faire, nous ni pour laver la main nous ni pour sanitiser la main nous, avec nous ni pour garder caractère si période yon et l'autre. Avec ces moun qui ka traverser l'autre pays qui a venu ici, backdoor, en le tikanot, nous avons dit ça c'est quelque chose qui n'est pas légal en pays. Ça c'est au compte loi. Avec si police chez bezo, yo qui fine zo. Avec nous avons dit moun là où aller en place publique, si vous allez en boss, si vous allez en supermarché, ou aller en la place là, on est pour ni massou en la main. Avec nous avons dit moun qui ni restaurant avec toute place publique, les moun rentrent en place où dit yo mettez masque yo avec sanitize la main yo. Avec et pas because quand nous dit pas passe, nous ka quoi tout bagay bon. Nous ne pour assis dans le avec d'accord tout bagay aisé non. Nous ne pour continuer qu'a fait ça nous qu'a fait pour chaîne vivre ça là Covid-19 rod nous. Merci autant.
And our thanks to the Honorable Kent Edwards, Parliamentary Secretary in the Ministry of Health, Wellness and New Health Investment for his presentation. Of course, I am certain that there are individuals, not just the Haitian community, but there are elderly individuals as well who would appreciate your presentation in Creole this evening. Thank you again to the Parliamentary Secretary. Our thanks to all of presenters this evening. This takes us to the end of this evening's update. Thank you, as always, to our media partners for making this broadcast possible. And we want to thank you, the listening and viewing public, for all you have done thus far to help the Ministry of Health, Wellness and New Health Investment, and by extension, the government of Dominica in this battle against COVID-19. As Dr. Esprit mentioned, the end is not yet in sight. However, if we continue to fight together, we will continue to reap the benefits of that effort. Thank you again, and have a good evening.